Welcome back to ophthalmology for undergraduates and postgraduate beginners. In the last video, we were discussing about hordeolum externum or style. Naturally, this video we are going to discuss about hordeolum internum. Before going to the clinical aspects of it, we have to understand what is this hordeolum internum. First, the definition. It is the acute suppurative inflammation of the meibomian gland that is called as hordeolum internum. Here I have drawn the lid with two swellings. The first swelling we have already seen in hordeolum externum or style, which is close to the lid margin on the outer aspect of the lid. Here I have drawn another swelling in this, which is close to the palpebral conjunctiva, which is somewhat away from the lid margin. As all of us know, the meibomian gland is situated inside the tarsal plate. Tarsal plate does not go up to the lid margin. So naturally, any inflammatory swelling in the meibomian gland will be away from the lid margin. Another important thing is the tarsal plate and meibomian gland are situated on the posterior aspect of the lid. So naturally, a patient will develop a swelling on the posterior lid. So that is why the swelling is on the posterior aspect of the lid, and in hordeolum internum, the swelling, unlike hordeolum externum, will not be very big. Why it is like that? The hordeolum externum is due to inflammation of glands of Zeiss and mole, which are in the soft tissue. But the meibomian gland is inside the tarsal plate, which is somewhat tougher. So naturally, before the swelling develops into a very big one, the patient obviously develops severe pain because it is going to form inside the tarsal plate. So that is going to be very painful. That is why the symptoms in hordeolum internum are more than in hordeolum externum. Apart from that, in hordeolum internum, there will be a pus pointing on the palpebral conjunctival side, that is in the tarsal conjunctiva. Unlike the hordeolum externum, where the pus pointing will be at the root of the eyelashes. So, this you should understand. The swelling in hordeolum internum will be smaller compared to hordeolum externum because it is going to cause severe pain, so the patient will come to you at the earliest. There will be a pus pointing on the palpebral conjunctival side and the swelling will be away from the lid margin. So this is a clinical feature of hordeolum internum. All the other symptoms and signs will be same like hordeolum externum. In this patient, you can appreciate a small swelling in the lateral 1/3 of the lower eyelid, which is somewhat away from the lid margin. When I everted the lid, there was a pus pointing on the palpebral conjunctival side, but before I could take this video, the pus started flowing out. He is a small boy presented with the symptoms of hordeolum internum. When I everted the lid, the palpebral conjunctiva was inflamed and you can very well appreciate a small whitish area in the center of the congestion, that is the pus pointing. Coming to the etiology or causes for hordeolum internum, similar to hordeolum externum, this is also caused by Staphylococcus aureus. All the causes that lead to Hordeolum externum also leads to hordeolum internum. But you have to add one more thing as a cause for hordeolum internum. That is, a chalazion getting infected leading to a acute suppurative inflammation of the meibomian gland can also cause hordeolum internum. Whenever we see a swelling in the lid, we have to describe them like any other swelling. Inspection findings like where it is located, what is the size of the swelling, what is the shape of the swelling, from where it extends, or which portion of the lid it is situated. Whether it is situated in the middle of the lid, or lateral 1/3 of the lid, or medial 1/3 of the lid, whether it is close to the lid margin or away from the lid margin. Like that, we have to describe the swelling properly in the case presentation. That is very, very important. Next, we have to talk about whether the swelling is tender, apart from the signs of inflammation like whether the swelling is warm or it is red in color. As far as the treatment of hordeolum externum is concerned, it is not much different from hordeolum externum. It is the same medical management which we give for hordeolum externum is going to be good for hordeolum internum also. That is warm compresses, antibiotic eye ointment, or you can give drops. Unlike hordeolum externum, where the swelling is on the outside, where we are going to apply the ointment, here the swelling is on the inside. So we are going to give antibiotic ointments or drops in the conjunctival sac. So eye drops can also be chosen for this case. Oral antibiotics. What common oral antibiotics we can give? Best antibiotic is oral amoxicillin. You can give oral amoxicillin thrice a day. Oral analgesics you can give for the patient. Strict hygiene, control diabetes mellitus, and give spectacles or treat any immunodeficiency diseases. You may ask, is there any surgical treatment for hordeolum internum? Very rarely we give any surgical treatment for hordeolum internum. It responds well to the medical management. Sometimes, if this hordeolum internum develops into a very big abscess, we have to do an incision and drainage. This can be done from the skin side by putting a horizontal incision, or it can be done from the conjunctival side with a vertical incision. So this is the treatment about hordeolum internum. Whenever a patient develops a inflammatory swelling in the lids, we cannot take chances in treating a patient. We have to properly treat the patient and we have to properly follow the patient until the disease gets cured, because these swellings or infective swellings or infective problem in the eye can lead to the complications. One is abscess formation, second is preseptal cellulitis, third is orbital cellulitis, which can cause ophthalmoplegia and loss of vision due to involvement of the optic nerve and the muscles and nerves. It can spread into the skull, causing cavernous sinus thrombosis and endangering to the patient. It can cause meningitis, encephalitis, or meningoencephalitis. A simple swelling can lead to all these complications. With this, we will come to the end of this video. You have to see both hordeolum externum and internum, and you should be able to differentiate between them. We will see about chalazion in the next video. Thank you.